Well, look at this. This is a popular show on the E! Network. It's called Botched, and as the title will tell you, it shows us some plastic, cosmetic surgeries gone wrong. On this episode, this is a transgender woman. She was getting her face fixed after getting injected with concrete. It's stories like that. They sound outrageous. We want to avoid them. Does that really happen in Metro Detroit? Well, we have renowned plastic surgeon Dr. Anthony Youn from Beaumont Troy Hospital here to talk all about these things. So I know you're so busy. Thank you so much for being here.
Oh, of course. Thank you.
And Dr. Youn's going to be in the chat room answering all of your questions. So first, let's talk about this issue of botched. You see these stories all the time, don't you?
Oh, yeah. And that patient that they showed here on the Botched show where she had the concrete basically injected in her face.
Yeah.
I've seen that here in Metro Detroit, this similar type of thing where they actually take liquid silicone or something similar permanent injection product and inject it into the face.
Why would you do that, first of all?
Well, it's cheaper a lot of times.
Yeah.
You know, some people just aren't educated too on their faith, you know, on the safe alternatives. And so instead of liquid silicone, picking the right procedure, something like Juvederm. This is 100% reversible, lasts a good year. Use something like this instead of the liquid silicone.
But you need your doctor to tell you, because if you showed me that silicone and said, I can put this in and give you whatever, it can boost you up and make you look younger, I wouldn't know that that liquid silicone was so bad.
Exactly. So it comes down to there are three ways to get botched plastic surgery. So the first thing is picking the wrong procedure.
Yes.
So if you're going to have something done, research it online. There are many websites where you can learn about the procedure. Make sure it's safe.
Okay.
The second thing you can do wrong is have the procedure done at the wrong place. I had a patient who saw me in the emergency room who had a tummy tuck done in Mexico to save money. And now normally if I do a tummy tuck, I'll put a drainage tube about this big in her, something real small.
Yeah.
Stays in maybe a week to drain out any extra fluid. For her, she came back with drainage tubes almost the size of a garden hose.
Oh my goodness.
And her doctor told her to have it taken out when she gets back into the States. So she flew on a plane with these in her and showed up in the ER to have it done. So have your plastic surgery done in an accredited location. A hospital like Beaumont Health Systems, like any of the good hospitals in this area, are great places to have your plastic surgery.
And make sure that your doctor is doing the procedure in these hospitals, right?
Exactly, because the hospitals will actually vet your doctor for you. And that's the third thing. The third thing is make sure that the doctor doing the procedure is actually a board-certified plastic surgeon. There are a lot of doctors out there who are masquerading as plastic surgeons. You know, the medical system today is fraught with problems, and so there are a lot of doctors who are leaving their professions and they're becoming plastic surgeons.
Yeah, you hang the shingle up, and the next thing you know, you go from being an eye doctor to suddenly doing plastic surgery.
Exactly.
The confusing thing is, Dr. Youn, is that there are so many board certifications that it's tough to figure out which one is the one that we're looking for.
Yeah, so you want to look for the American Board of Plastic Surgery. If you're looking for facial plastic surgery, then the American Board of Facial Plastic Surgery is reasonable as well.
So American Board
of Plastic
first
Surgery.
Two words. Okay.
Another thing you can do, though, is your hospitals will vet the surgeon for you as well. Hospitals always vet the doctors that come in, and they only allow them to do procedures that they have residency training in. Okay, so they will not allow an ER doctor to perform a facelift in an actual hospital because they know it's the wrong thing to do.
So if you're going to a good, decent hospital, they've done the homework for you.
Yeah, so I'm a member of the Beaumont Health System, and so you'll know that they have a team of plastic surgeons that they do not allow them to perform procedures outside of their expertise.
Okay. What are the two procedures that you see go wrong the most?
The most common procedures that I see go wrong that are really botched are either liposuction, using an instrument like this. Basically, you suck the fat out, and it's usually overdone when I see it, so it's large indents, divots, that type of thing.
Yes.
Or it's breast implant surgery, and I see countless patients who come in with implants, huge implants like this, in tiny bodies, and it's going to be fraught with major complications. So those, for some reason, when you have doctors who are botching these operations, they're doctors who aren't plastic surgeons, they pick those two operations typically to do the most.
And those are probably the two most procedures done, right?
They're also
most popular.
The two most common and most popular plastic surgeries, exactly.
All right. Well, there's a lot of good that can come from good plastic surgery, but you'll have to be so careful. And so that's what we're talking about this morning. Any question you have for Dr. Youn, jump into our chat room at myfoxdetroit.com. You can talk about, you know, if you're thinking about having something done, but also I know you see so many patients that have had bad plastic surgery here in town, and they say, can you fix it? So maybe that's a question for Dr. Youn. So we'll get into the chat room. When we come up in the 9 o'clock hour, we've got some great stuff to talk about. Things in your kitchen that might, you know, give you a little bit of a lift, make you look a little bit better. That's coming up.